The closure of a vital federal laboratory dedicated to tracking sexually transmitted infections, STS, marks a grave turning point in the United States' ability to combat the growing threat of drug-resistant gonorrhea and other infectious diseases. This lab, a crucial facility for tracking the evolution of gonorrhea and ensuring the country's preparedness in fighting sexually transmitted diseases, has been abruptly shut down, leaving the nation without a critical resource at a time when STI rates are rapidly increasing. Among those affected by this closure were 77 skilled scientists employed by the Centers for Disease Control and Prevention, CDC. These scientists played an integral role in gathering, analyzing, and storing STI samples from across the country. Their expertise in detecting genetic markers for drug resistance, particularly in gonorrhea, was unmatched. With their departure, the United States now faces a significant gap in surveillance capabilities that could have far-reaching consequences for public health. The loss of this lab means that nearly 1,000 samples of gonorrhea and other sexually transmitted pathogens remain unprocessed, their potential value in tracking resistance trends left untapped. What's worse, there are concerns that even more samples will be sent to the agency, only to be stranded without a system in place to properly manage them. This could result in a devastating backlog, making it nearly impossible to assess how the bacteria have evolved and leaving scientists without the critical data needed to monitor and address these changes. As rates of gonorrhea rise, with 600,000 new cases recorded in the U.S. in 2023 alone, the implications of this shutdown are dire. Gonorrhea has already become resistant to nearly all antibiotics, leaving only one class of antibiotics effective in treatment. However, emerging evidence suggests that even this treatment might soon be ineffective. The closure of the lab halts efforts to track these dangerous developments, leaving public health officials in the dark about how the infection is changing and how it might continue to evade treatment in the future. For years, the CDC's lab had archived approximately 50,000 gonorrhea samples, the largest collection of its kind in the world. This resource allowed scientists to track the pathogen's evolution and anticipate the rise of antibiotic resistance. The lab's shutdown puts that invaluable collection at risk, with no clear plans in place for how these samples will be managed, analyzed, or used in future research. The loss is compounded by the increasing use of new public health strategies like doxypep, an intervention that provides antibiotics to gay and bisexual men and transgender women after unprotected sex in an effort to reduce syphilis and chlamydia rates. However, this strategy raises its own concerns. Widespread use of doxycycline could potentially lead to greater resistance across a range of pathogens, including gonorrhea. The CDC's ability to track these developments and analyze whether resistance is increasing has been severely hampered by the loss of these vital resources. Without the ability to track gonorrhea resistance, the United States is essentially flying blind in its fight against a growing public health threat. The absence of a national surveillance system means that the country cannot accurately gauge the effectiveness of existing treatments or develop new ones. This not only hinders efforts to curb the spread of gonorrhea, but it also leaves the public vulnerable to a host of other infectious diseases that might slip under the radar without proper monitoring. The fired scientists, who collectively possessed around 1,400 years of field experience, were not easily replaceable. Their expertise cannot be replicated overnight, and the gap left by their departure means that crucial research and development may be permanently stalled. Many public health professionals are deeply concerned that the United States has lost its ability to respond to evolving threats in real time. Without the expertise and infrastructure that the CDC lab provided, it is unclear how the country can maintain an effective response to emerging public health crises, let alone ensure the proper treatment and prevention of existing diseases. The decision to shutter this lab underscores a deeper issue within the U.S. public health system. With the national surveillance network now dismantled, there is no clear alternative in place to continue the crucial work of tracking and combating drug-resistant infections. This lack of foresight in maintaining essential public health infrastructure reveals a dangerous short-term mentality that risks long-term consequences. In the absence of the CDC's monitoring efforts, there is no guarantee that any other agency or organization will step in to fill the gap, particularly as funding for such critical research is being slashed across the board. Moreover, the closure signals a broader trend in the erosion of public health funding and infrastructure, leaving the nation vulnerable to the rapid spread of infectious diseases. Public health officials have long warned that the country's ability to combat drug-resistant bacteria would be compromised without continuous surveillance, research, and resources. Now, with this vital lab closed and its scientists fired, those warnings seem to have been ignored, potentially leading to disastrous outcomes. In conclusion, the closure of the CDC lab dedicated to monitoring gonorrhea and other sexually transmitted infections represents not just a significant loss of expertise and resources, but a devastating blow to the nation's ability to protect public health. Without proper monitoring, the U.S. is at risk of falling behind in the fight against drug-resistant infections. The impact of this closure will be felt for years to come, potentially exacerbating the spread of gonorrhea and other STDs, and leaving the country ill-prepared for future health crises. The decision to dismantle this critical infrastructure is a cautionary tale about the dangers of underestimating the importance of long-term public health planning.